This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Today's weekly COVID-19 podcast is for the week of May 18th. The hospital at this time is doing very well in regards to handling the treatment of COVID patients. We've obtained tremendous experience and are doing quite well with that. And I'm very proud of our teams. From door to door, they've done an excellent job in taking care of COVID-19 patients. We are starting to see that the patients with chronic medical conditions that have, I don't know if neglected or ignored coming into the hospital or seeing their physician, is starting to accumulate. And the hospital census today was at budget, that's in quotation marks, but the census was what we would expect it to be. It was actually 2 patients over, which means we're back to where our normal volumes were. And the hospital is going to continue to get busy, particularly with going to phase 2 of our surgical restoration, which will start on Monday. We'll be increasing the surgical capacity. That may lead to I anticipate there's going to be a spike of COVID, perhaps in a couple weeks, but I'm very confident that we have the capacity and the knowledge as well as the resources in staff and supplies to handle that spike. However, we continue to need to practice social distancing and reduce the transmission of the contagion. That discipline that we've demonstrated needs to be maintained as we start to reopen the economy and businesses. A recent news story described a rare disease that was cared for in St. Luke's Pediatrics, possibly associated with COVID-19. And what this essentially is it's Kawasakis disease, just like the motorcycle. And that's how I always remembered. The M is for motorcycle, and M is also for medium, because it affects the medium blood vessels. So you have small, medium, and large blood vessels. And it causes inflammation in the medium blood vessels and can cause symptoms from head to toe with the inflammation in those blood vessels. This is a relatively uncommon condition in pediatrics, and there is the belief that it may be associated with COVID-19 and that sort of a post-infectious phenomenon, with the original infection being several weeks prior and also the child being, for the most part, asymptomatic during that time. With the leadership of Dr. O'Connor in the hospice program and Dr. Bertel in cardiology, because Kawasakis does inflame the blood vessels of the heart, they have performed stellar work, and the patient is doing well and anticipate complete recovery. We will have Dr. Bertel on in a future podcast in the near future to describe the treatment as well as the diagnosis of this particular condition. It does make one speculate, are there other post-infectious phenomenon that we'll be seeing from COVID-19? And it's too early to tell. But regardless, if we keep clear minds and quick hands that are also clean, we'll do fine with anything that this contagion may present. We know what we do and we know how we do it. It's times like these we learn the why. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unitypoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.